probably the bigger problem on health is a lack of healthy foods. And those are what are called food deserts, as you guys probably know, right? Baltimore is plagued by a lot of food deserts. So that's number one, the health aspect, health leg. Second is having affordable, safe housing in safe neighborhoods where you don't have to worry about being shot when your kid goes outside. And that's lead-free housing, mold-free housing, the kinds of stuff that many of us, I would hope all of us grew up in, kind of just taking for granted is not available for 40 or 50% of Baltimoreans. So that's the housing issue. Third is decent public education that prepares kids for 21st century economy, where we even have, even the decent schools in Baltimore City are basically 1950s based style of teaching, and they maybe have a STEM program or two, but really don't concentrate on that or IT, information technology stuff that you need to have.
Baltimore City is in a health crisis, and that we need to be reached out to in a meaningful fashion to take care of our patients. I want people to know also that number two, that total health care is there, has been there, will be there in the future to take care of these patients, because we are very invested in this neighborhood. We want to take care of everybody so that they're able to reach those goals. We want to bring the standard of health in this neighborhood up to national standards. We don't want to be the neighborhood and the area where the life expectancy is low and people are dying from preventable things. We want that to change.
I don't believe anything a doctor say. I'll take it in consideration. I'll try this. But if I can't feel or notice any change in me, I'm not taking that medicine. I'm just not going to take it because you told me to take it. I'm not going to do that. And if you don't show me that you are really concerned about my health, I don't want to be bothered, because it's a waste of your time.
We've always faulted in favor of the patient, even when there were times when insurance was in question. We've always kind of resorted to or favored it, and in lieu of the patient, make sure they got their meds. When there's a touch-and-go situation, we've always been more concerned about the patient getting their medications and actually getting paid for the medication. We had prescriptions today we couldn't fill because the state had issued a contract to United Healthcare that eliminated the majority of all independents from participating. So we were kind of in network one day, we were knocked out of network the next. So from a business owner standpoint, there were patients I could no longer fill prescriptions for. From the patient standpoint, they had a much reduced variety of stores to go to. So it's not the satisfaction of knowing you're helping people, the satisfaction of people counting on you, that there's a reliance upon you being in the neighborhood, there's reliance upon you for advice, for being there when they need help, and being able to help out people in time of need, and trying to improve the quality of their life and their health.
The classes varies. You have people who have gym memberships, and you have people who don't. You have people who are 50 years old, and you have people who are 80 years old. So what we try to do is give them those basic techniques that they can use on their own, like walking, like doing stretch bands. I say to them, you can sit when you're watching TV, just do your stretches. You can sit right there instead of just sitting down. I said, you can just do your little exercise, move around, go up and down your steps. I said, walk around. Don't park closer to the grocery store. Park a little ways as long as it's safe. I said, that way you get your 5-10 minutes walk. I said, and when you go into the groceries, just don't go pick up stuff and walk out. Just walk around the aisle. Just use your cart. The 80 years old, you told them, just walk around. So I think they appreciated that. And the important thing is somebody is coming in to work with them, to teach them, to educate them, which I think has been the key. Because how many of us read labels when we go to the grocery store. But now, when I look at the surveys, they tell you, oh, I'm reading the labels, I'm looking at the sodium content, I'm looking at cholesterol. I said, oh, good, oh, great. So I'm excited, it's working.